All right. Nurse Nicole, can you see the screen?
Yes.
All right. Awesome. So today's presentation is breaking free from diabetes. As introduce myself, Dr. Dennis Ciccone. I've been practicing just over 17 years in the functional medicine and holistic space and helping patients get better through lifestyle changes and health and habits. And I'll have Nurse Nicole introduce herself briefly, and then we'll get into it.
Yeah. Hi, everyone. Nicole. I've been a nurse for pushing about 30 years now. My specialty has been in home care, dealing with patients that come home with chronic illnesses, acute illnesses, lots of diabetes teaching, of course, new diabetics, old diabetics. So my specialty has been in the home, teaching clients how to use new medications, test for diabetes, signs and symptoms. In the last about 5 to 6 years, I've started to widen my practice to more functional teachings, bringing in lifestyle changes for people more so than medication, to help with preventing disease and treating disease as well. So I do also help run a health and lifestyle diet teaching, diet coaching, and personal training practice as well.
Yeah, and the way I met Nurse Nicole, she called me to help with some things that she was already kind of working on in regards to hormones. So her and I have been working together and kind of building these things together for you guys for a while. So I'm excited to have her here. Glad you're here, Nurse Nicole.
Me too.
All right, so let's get right on into it. So what are we going to cover today? We're going to cover the current status on diabetes. It's obviously a very serious condition. Many people are sick and don't even know they're sick, which we'll cover in a minute. We're going to talk about what are the current options in the medical world and are they working? How successful is that? And then we're going to talk about what are some alternatives that we can look at, maybe a better system that we can start working on, some lifestyle changes and things that we can do to test and help create a better plan. And then what are the next steps for you guys from there? Things that you can leave here today starting to do. And then if you feel like, hey, I really need some more help or some more testing on this, we can talk about that as well. So let's talk about the current stats. So currently 37 million people have diabetes in this country. 1 in 5 don't even know it. So imagine that 20% of the population doesn't even know they have diabetes, and they're walking around. Their body is damaged, inflammation is high, higher risk of cardiovascular health, losing joints, vision, all these issues become serious issues on the diabetic side. 96 million have prediabetes, and we'll talk a little bit more about what that is and what that really means in the presentation as well. 8 to 10 don't know it again. So again, think how many people that is. That's such a large population that are dealing with these sugar issues. And think about our culture now and what it looks like. Refined carbohydrates and sugar is in everything. When we start working with clients to start coming up with customized nutrition programs and they start reading labels, they get surprised at how many things sugar is in. I mean, it is in almost everything that you wouldn't even expect. Diabetes is the 8th leading cause of death in America. So again, that's really high. Like cancer is number 2, I believe, or number 3. Heart disease is number 2, but diabetes is number 8. So this is a big reason that people are losing their life as well. So this isn't just something that you need to deal with in your life here and struggle with, but it actually kills you. So it's a serious condition again. Type 2 diabetes accounts for 90 to 95% of these diagnoses, and it's lifestyle related. So one thing I wanted to talk about is they used to call this adult onset diabetes. Now they call it type 2 diabetes because so many kids are getting it, they can't call it adult onset anymore. So this is a disease that is expanding and spreading because of the lifestyle we have around sugar and refined carbohydrates and just not having a good, healthy lifestyle that's now affecting our children at a high level. And more kids are coming in with this, with obesity issues as well, heart issues, and these diabetic problems. The numbers have doubled over the past 20 years. So not only is this serious and it's affecting the youth, but it's continuing to grow, and the trend isn't starting to come down by any means. I mean, this is just continuing to climb and be a bigger issue. And this is a $327 billion industry. So think of the money that is made when people are sick and when they're not getting well. So I just wanted to talk a little bit about the mechanism before we look at kind of a better way of looking at this. Basically, the way this works for anybody that is new to the diabetes world, just to get a good understanding of this, is basically when you have increased sugar or refined carbohydrates at a higher level than your body wants, it's going to produce insulin. And the purpose of insulin is to get that glucose out of the blood and into the cell. That's its job. And that's what's supposed to happen. So at any given time, a healthy individual only has 1 teaspoon of sugar in their bloodstream. So the body is very good at, when you eat sugar, because obviously like Coke has way more than 1 teaspoon, lots of things have way more than 1 teaspoon, cake has more than 1 teaspoon. The body's very good at regulating that and getting it into the cell where it's healthy, because it's in the blood where it becomes a problem. Okay, the cell can use sugar very effectively. So what happens is, if you continue to do that and the level is higher and higher, insulin is going to start to go up, and eventually the cell is going to get overwhelmed and it's going to start to have what's called insulin resistance. So that's what happens at the cellular level, is the cell starts having insulin resistance and it's not able as effectively to get sugar into the cell. Okay, that's not the biggest problem. What then happens, because your body is so brilliant, is the pancreas starts making more insulin. And what that does is it overrides the insulin resistance to the cell as long as it possibly can, until the pancreas eventually gets fatigued, burns out, and stops making as much insulin as it needs to do. Once that happens, that's when blood sugar starts to rise and patients move towards this pre-diabetic state, which you'll see on like an A1C level. Or if that continues and it's not corrected, then they move into diabetes. And what the newest research is showing now is, if you have type 2 diabetes that's not controlled long enough and you continue to work against this, it's actually leading to what they're terming now type 3 diabetes, which leads to dementia. So this creates long-term brain damage if it continues to be unresolved. Now, the current medical model has medications as a solution to this. So it's not about looking at lifestyle, and I'm not saying they don't make lifestyle recommendations, but the easiest and quickest way to get this corrected from a crisis standpoint is medication. And what the medication does is, there's a couple options. One is insulin, obviously, to increase and support the pancreas. There's medications that decrease the insulin resistance at the cell so that more of that sugar can get into the cell. And they also have medications that just support the kidney to excrete sugar at a faster rate to clear it from the body. So those are kind of the 3 mechanisms that they use to help control this in the medical side. My question, if you're hearing all this and everything we just talked about, and knowing that this is 90 to 95% lifestyle related, how well do you think this is working? It's a $327 billion industry. It's growing, doubled over the past 20 years. It's affecting our children. Like, we need to look at a different option. So that's why when Nurse Nicole and I look at things like this, we say, all right, they got what they're doing, right? And it's obviously working to manage it so that it's not getting to a critical state. But what can we do to then do the parts of the lifestyle side that could be highly supportive and help 90 to 95% of these patients? And that's the goal and what we're going to work through today. Because certainly it's not working and we need a new system. And that's where I know some of you are already clients of mine. I'm going to give you some action steps to do as well today. But for those of you who are not, I'm going to share a lot about our program and how we get results as well. So let's look at our overall process. And if any of you have never seen our website, I would encourage you to do that. It's CicconeWellness.com. And there's lots of information on there that shares just kind of what the approaches are, our 4-phase approach. And first thing we look at in the office is the nervous system. The reason being is the nervous system controls everything in your body. So I work virtually with all of my patients. So I have patients all over the country. And if you're in need of chiropractic or physical therapy or something like that, that we think the nervous system is playing a role on this, I will help you to find a practitioner in your area that can help to address this and make sure it's the right one that's promoting health and working in the right direction so that we're working as a team for your health. The other thing we look at is gut health. If your gut is not functioning well, that's going to affect your immune system. It's going to affect how well you're absorbing, how you're managing these sugar levels, how everything is coming in, as well as these inflammatory markers. So it can start to create damage even at the level of the gut that we can start to help address these things. After we get the gut healed so that we make sure you're getting in the right nutrients and working on like a customized nutrition plan and helping you through that, the next thing we look at is liver health. Liver is where much of your sugar is also stored. So liver health is very important when you're looking at the diabetic side. The other thing is sugar is very toxic. So if you're not getting proper liver health and going through a proper detox process to help support the liver, many of the diabetic patients are getting things like fatty liver. And many of you have probably heard that at your doctors if you're struggling with prediabetes or diabetes, or you know a loved one that is dealing with this. So we got to then look at the liver. The other reason the liver is so important and why we have it before hormone health is many of your body's hormones, which help you to heal, are put into their active form in the liver. So if the liver is not doing what it needs to do, then you're not going to be getting that healing side of those hormones. And then the last thing we look at is hormone health. And the reason we look at hormone health last is many of these other things will deplete hormones. But the reason it's so important to look at it last is once everything else is corrected and it's doing what it needs to do, hormones are what allow for healing and recovery. Okay, insulin is also a hormone, right? So we need to make sure the hormones are working properly. The hormones are basically your body's mechanism to talk and communicate so that it's getting the information out that it needs to get out, and the body basically it can't talk, right? So it talks to itself through hormones and those mechanisms. So that's the process I take a patient through when we look at this. And when we're trying to look at an overall lifestyle approach to help somebody with diabetes or really any condition, the process is the same. Just how we approach each of these levels is going to be different and customizable based off of what your symptoms are and what you're struggling with. One of the things we'll talk about at the end is the testing that I'm going to recommend for you today is actually called the Dutch test. And what the Dutch test does is it looks at the hormones specifically, but it's going to give us a really good picture of how the liver's functioning. How is the gut functioning? Are there any infections? Is there any inflammation? Is your body in a state that it's creating DNA damage and setting you up for potential cancers or other types of things in the future? So that's why we really like to look at this. And the other quick thing I'll say on this is the reason I have trees growing up slowly is each one of these builds on a foundation of the one before. So you can't just skip a step when you're looking at building true foundational health. You need to build off of each one of these steps, and it takes time. It doesn't fix overnight. So Stephanie, I see it's called the Dutch test, DUTCH, stands for Dried Urine Test Comprehensive Hormones. And I'm going to go over more about that test at the end. Mm-hmm. So the next slide we have here is same trees, same process, but what causes the damage, right? So now we understand the mechanism of how to fix these things, but what is it that we really need to manage for ourselves to help minimize this? Because I could give you all the tests and all the supplements and all the coaching in the world, but if you continue to do the behaviors that created it, it doesn't really matter, right? You're working against yourself. You might be better off, but you're not going to be as the way to truly get well is to fix these other things that are going on. So I'm going to have Nurse Nicole talk a little bit about this once I'm done, because she has some great ideas that she works with her clients. Mm-hmm. But traumas, toxins, and thoughts. We call these the 3 T's, and these are the things that create disease in your body. So just thinking about trauma, for example, if you've had physical pain, lots of times when people are in physical pain or emotional pain, they'll go to comfort foods for eating. So again, we need to look at foods when we're looking at this, especially the sugars and refined carbohydrates, if we're coming up with a mechanism to really get well. Toxins. We talked about toxins such as sugar can create tremendous stress to the liver. So again, it's a nutritional recommendation for there. And then thoughts. Many of my clients, regardless of the condition they deal with, but many diabetics as well, are dealing with what they're saying to themselves every day. It might be things like, I wrote a couple down here. So my family had it. It's genetic. I have no control over this. I can't stop eating. My cravings are too heavy. I can't control them. Who cares? I like what sugar tastes like, right? Like all of these things that if somebody we loved or our kids said them, we would tell them they're probably nonsense. But when it's us, it's hard to say that. Or we might have a doctor that, says, hey, this is just the way it is. There's no solution for this. This is just the way it's got to be. There's no other alternative. Nothing you do lifestyle will make a difference. So you got to start looking at those thoughts that you're telling yourself and start looking for alternatives to start to change those things. And then I'll have Nurse Nicole share kind of some of her strategies that she works with clients to help keep blood sugar down also.
Did you want me to go through that now?
Yeah, please.
Okay. Yeah. Yes, I recommend first and foremost, of course, eliminating some of those really refined sugars from your diet. Is a treat okay here and there? Absolutely. Something to eat every day? No. Those are called treats because they're special. They're not supposed to be a part of your diet and your daily diet and process. So first and foremost, eliminating them for the most part. A second thing that I always recommend is activity. Start moving your body, even if it's a walk, even if you're sick enough where you can only walk to your mailbox. Start there. Start there for a week. The next week, go to the mailbox and walk 1 house over on the street. Then the next week, walk 2 houses down. It's all going to stack upon itself as you get healthier. Start maybe adding weight to your body on your walks. Maybe wear a backpack with 1 book. Maybe the next couple months, 6 months from there, wear a backpack with 2 books. Or if you have the opportunity and the resources, start going to a gym and hire a personal trainer, or maybe something online that can go through movements with you and teach you the movements correctly, how to do the movements at a gym. It doesn't need to cost a lot. You can carry something like a book, or if you want to invest further, you could hire a personal training per se for more money, of course, but it doesn't need to be fancy to be effective. So those are the first 2 things for sure that I recommend. And the third thing that I would recommend is testing. Keep in touch with your healthcare provider and follow the appropriate testing to see where you are going with the differences and the changes that you've implemented so that you can see if they're working or not and to adjust accordingly.
You want to talk about protein again? That was another one.
Yes. Yeah. So that's another thing that I recommend for people always is to, protein is the, foundation, of our cells. It's what provides cellular turnover and helps build cells. So I always recommend people provide their body with healthful protein. First thing, again, once you decrease some of that sugar intake, is to increase your protein intake. That can be animal protein. It can be dairy protein. It can be plant protein like edamame, tofu, nuts and seeds. They all have protein in them. It doesn't have to be red meat. It can be all types of meat, all types of dairy, all types of nuts and fruits. Vegetables have protein. Some of them have protein. So protein can be in all sources. And that's the one of the last things too that I recommend. That will help decrease some of your hunger pangs. When you're satisfied, you will have less of those cravings and thoughts. and you'll have more energy to do your walking if you have implemented that in your routine so far.
Yeah. And like if you think about what Nurse Nicole said too, and like just the process and how this works, and what I was talking about when the sugar comes in, it goes into the cell. The reason the cells take it up is for energy. So sugar works for an energy source. The problem becomes when you're not using that energy source up. So
Right.
if you know you're going to be active and you know you're going to have a treat that day, the best thing to do is to have the treat right before the activity, because now you're maximizing how your body burns that off and utilizes it. Because if it utilizes it, then it's not going to be sitting in your blood either. So if you start planning accordingly, that's another trick. The last thing I'll add to it for what Nurse Nicole was saying is intermittent fasting is another thing you can start to do. Intermittent fasting works in a very similar way. Your body still needs energy. So if you're not eating or adding to that, your body is going to burn up that sugar. You're still being active. You're still breathing. Your body's still functioning. It doesn't
Yes.
have to be excessive exercise to burn this off. But if you're not putting anything else in, the first thing the body's going to utilize is sugar, because it's its easiest fuel source. That's why, like, when people talk about going into ketosis or these other types of plans where they're fasting for long periods of time or not having any sugar at all, basically the body will use ketones as its second source, because it's harder to access ketones than it is to just from a biological standpoint to break down. It's easier to utilize glucose than it is ketones. So your body is always going to do the simplest thing. But if you're in a position where you're planning accordingly and you're doing the intermittent fasting or working out or cutting these sugars, that level is going to drop and your body is going to be forced to either burn those sugars off or move into ketosis and support that side so that you're not having those blood sugar levels. The other thing I would say is I can never recommend to anybody to come off of a medication or change a medication or anything like that. It's not in my scope of practice. But I would recommend, if you are diabetic and you are on a medication to manage that and you're tracking those numbers and you start making some of these changes, you're going to see those numbers change. So just reach out to your healthcare provider and say, hey, these numbers are changing. Do we need to adjust the medication or make any of those changes? And they'll help you with that, because if you're getting healthier, they'll be there to support you to come down on those levels. I have a guy right now that he was at 200 units of insulin. Within 6 weeks of working with me and going through a similar approach to what we're talking about, he's already down to 40 units a day. I mean, that's a big drop, right? And his doctor is very happy. I've had other patients that they are on medications. The doctor takes him off metformin because he doesn't need it anymore and he's functioning better. So I'm here to tell you, like, these things work and they get results. The way you get results is to be consistent with them. And the way you get the support on the medical side is to make sure you're reaching out to your doctor who should be monitoring those things with you. So the next thing is the solution. What do we do with our clients? Because it's not just about having these processes. Diabetes causes damage, right? So we have to first identify where the problem is. Is it nutritional? Is there an infection? Is it inflammation? Is it toxicity? What is the cause? Because once we can get to the cause and identify it, the next step is then to remove it. Sometimes those are lifestyle changes. Sometimes that's giving you supplementation. But whatever that is, we need to then remove the damage, right? It's like if somebody's banging holes in my wall, like, I can go repair it all day long, right? But if I don't stop the guy banging holes in my wall, I'm just spending a lot of money, time, and I'm very frustrated because there just keeps being holes in the wall. So first we got to identify who's banging holes. Then we have to remove the person. Then we have to do the last phase, which is healing. If you do all of these steps in this order, then you're truly healed. You don't have to rely on my services or medications or anything, because the body truly heals. Of course, unless there's so much damage that it got to the place that it can't, then it will heal to the best place that it possibly can. And then you can make those determinations there. But it's so important, because I talk to clients all the time that either their practitioner is just removing the issue, or they've only identified it, or they're only working on the healing side, and they don't look at all of these pieces in place, or like the 4-phase approach I talked about at the beginning. And what happens is you don't build a strong foundation. Then what happens is everything crumbles as soon as you stop doing it. So you end up using these supplements or lifestyle treatments almost like medicine as a Band-Aid, but you're not actually solving the root problem. Okay. The next thing I want to share with you guys is just a trick that I've learned over the years. Can you guys see all the writing, Nurse Nicole? Okay.
Yeah.
So I have a chat box just so I can interact if people are talking, but I have it covered. So I wanted to make sure it wasn't covering the screen. So gymnema is an herb that I use with many of my diabetic or patients that have cravings. This is one of my favorite herbs. My recommendation is if you're using it for if you just have blood sugar issues, because it helps to stabilize blood sugar as well. Cravings all the time, always love sweets. I recommend doing a half a teaspoon twice a day of this. I also recommend if you have a really strong craving and you know you're about to break, have an additional 1 teaspoon right before that. One thing that this herb does, other than help to get rid of the cravings and stabilize the blood sugar, is it will actually cause you not to be able to taste anything that's sweet. So just imagine you have a cake or something that you know you're going to indulge in that you shouldn't, and you don't have the willpower to overcome this. So what you do is you say, I do have the willpower to take 1 teaspoon of gymnema. You take the gymnema and then go have the cake. You're not going to eat as much because you're not going to taste it. It's not going to be enjoyable. You've kind of blocked your excitement that maybe had so much control that you didn't have the willpower to deal with. So if anybody does want this herb, I can send you a script in a company we use called Full Script, and I can give you 10% off your first order. All you got to do is message me privately, so not everybody sees your information, but just first name, last name, and email, and I'll get that sent out to you today. But gymnema has been very powerful, helping many, many of my patients. So let's talk about some of the other processes too. So one of the tests that we look at in the office is a food allergy test. And the reason we look at this is inflammation plays a huge role in the body with diabetes as well as heart disease. And when you don't know what you're eating and what's causing inflammation, you can think you're doing the right things, but you're not necessarily are. So many patients that I will test are allergic, like if you look at the screen, apples, for example, carrots, right? Cilantro, like not things, watermelon, that you would never think would create inflammation or cause damage to the body. So it's not just about cutting out sugars and carbohydrates. It's about coming up with a true plan that is going to maximize how your body functions. What you have to keep in mind is diabetes creates disease. So in order for your body to heal from disease, you need to have the strongest ability to recover from these things. And one of the ways to do that is to minimize the damage coming in. And we do that through nutrition. So Nurse Nicole, were you surprised when you got your food allergy test back?
I was, yeah. And I did the whole 4-phase approach with Dr. Dennis. I was having menopausal, changes, lots of symptoms to kind of go along with that time in my life, and was seeking out help. I was doing everything I knew how I could do. I just needed that last circle of the Venn diagram. I needed that center. So I reached out to him. We did all the things. We started with the food allergy test, and I was surprised at some of the things that I reacted to. Keep in mind, everybody, that whether you find a food in your red, orange, or yellow column doesn't mean that you have a true allergy to it. What that means is we need to let the body rest. We need to let the gut rest. We need to let it heal during that time. Is your body reacting to the food because it's inflamed and it just doesn't like anything? Or is it a true reaction or a true sensitivity or allergy? We have to start at square one, kind of clean out the closet, start with it empty, clean it out, and then start putting things back in to see how it fits and how it looks, how it reacts to your body. So don't think that I'll never be able to eat those things again. This is like a clean out. We're wiping the board clean. We're healing that board with any dents and dings and stuff in it. And then we're going to start putting things back and seeing how you react to it. If there's a reaction, then of course that food should be eliminated from your rotation. And you can revisit it certainly at another point in your life. However, but that's how the food allergy, testing primarily works.
Yeah.
And
And
I
usually
really enjoyed it, actually. It made me feel great.
Yeah. And usually we'll retest after a year, and like Nurse Nicole is saying, like the foods change. You get less on your list. You're able to eat those things again. And like she said too, it's not like an anaphylactic reaction when we look at this. This is creating chronic inflammation in your body over time. So that's what we need to look at and address when we're looking at the foods. Another test we do in the office is a stool test. One of the reasons stool tests are so important, it gives us a lot of information about how your gut is healing, whether there is inflammation down there, how much damage there is. It also tells us the good bacteria and the bad bacteria. I would say 80 to 90% of the clients I test have at least a bacterial, a yeast, or a parasite infection. That is, again, creating damage. And when I want you to think about this process, I want you to think about your body only has so much reserve to heal. Diabetes damages that. It doesn't allow the body to recover. So if you now have these other infections that your body's trying to manage, that takes up more reserve from what it could be doing to the diabetes. So the body gets overwhelmed. So if we can start clearing these things out, like Nurse Nicole was just saying with the foods, then all of a sudden, the body's going to have more access to be able to do this healing. You're going to feel better. Your energy is going to be better. If you think about sugar cravings, there are actually yeast and bacteria that will send enzymes. Like, let's say you stop eating sugar today. Let's say you just make a decision, I'm going to cut out my sugar and refined carbohydrates. These bacteria or infections actually live off of sugar. So what happens is when they're not getting sugar, they start to die. And when they start to die, they actually create enzymes that send signals to your brain that create sugar cravings to make you eat sugar so that you eat them so that they don't die. I mean,
it's like
crazy.
Their last breath.
What'd you say?
It's like their last breath. Feed me.
Yeah, it's like their last breath. They just
die.
want some sugar. So, and sometimes we feel like that as humans, right? Like, I think the solution to not having sugar cravings is probably death. Like, I think that's probably the answer. But I mean, there are reasons. And if we can get these things cleared up, those cravings go away. You don't have to struggle so hard all the time. And again, you have more of those reserves. One thing I love about this test too is not only will they tell us what bacteria or infections you have, but they will then grow that bacteria in a lab and then use natural treatments to kill it. So you can actually see what the right treatments are, and then I can target those treatments with you so that we can actually make sure that this is eradicated and killed for good, and we don't have to deal with that anymore. So I love that about the test, and it just gives us kind of an upper edge on these bacteria and other people that aren't doing the comprehensive testing that we're talking about, because it lets us see exactly what's going on.
Dr. Dennis, before you move on to the Dutch, Katie, did you have your hand up? Did you want to ask a question?
No, I'm good.
Okay. All right. Just checking.
So the last test we're going to talk about is the Dutch test. And you can see there's a lot going on the screen. So if any of you, I know a couple of you that I work with, we've reviewed a Dutch test before. Like the food test, it's like, hey, here's the colors, eat these, don't eat these. The stool test is like, here's your infections and how to fix it. The Dutch test is like a little overwhelming, right? It's like 13 pages. It's like lots of words and numbers and how does this interact and how does that interact? All I will say about this test and why it is so important is the test looks at very in a comprehensive way, many factors that give us answers to what we've been talking about so far. So there's a marker on the Dutch test, for example, that will tell us if you have gut infections. Okay. And then maybe we'll do the gut test if so. If not, then maybe we won't. There's markers that will say whether you have inflammation or not. If so, maybe foods are another place to look. Gives us direction. It'll let us know how depleted your hormones are. How well are you sleeping? Is your body set up to be creating DNA damage or creating cancer? How well are you aging? How well are you recovering? All of these markers, toxic load, it will tell us how well your liver is clearing, toxicity markers. So when I look at the 4-phase approach, there's lots of different pieces that we want to build up. This is the easiest and simplest, most cost-effective way to say, hey, I want to look at one test, and then I want to start to develop my plan and know which pieces I need to put in instead of just jumping in and doing the entire plan. So my recommendation, and anything you want to share on that one, Nurse Nicole, before we close up?
No, I just have so much respect for the Dutch test and people who use it, because it's like a microscope just into your hormone in your body. You know, it's like it gives you so much information to work off of and to let your practitioner know where to go and how to help you.
Yeah.
It's really a cool test.
Yeah, it is my favorite test to give the most information for the least expensive cost. So I just put a link up for anybody that's on here today that is interested in doing the Dutch. As I told you, I saw one of you messaged me. I will send over the Gymnema script to you. That's the easiest way to start. Just start with the Gymnema and start seeing how those cravings go, and start making some of those lifestyle changes, like cutting the sugar, cutting the carbohydrates, intermittent fasting, moving more, increasing protein, working on your mindset. These are all free things you can start doing. Well, protein's not free, but you have to eat, right? So it's almost free, right? It's a lateral move, right?
Yeah, and if you start, you don't have to do this and do that and do everything. If you're somebody who is in a rut, and let's say you're having ice cream or donuts every day, cut out one day this week. And then next week, cut out 2 days. Start where you're going to achieve success, because that success is going to breed motivation, and that motivation will breed consistency.
Yep, totally agree. The other thing we're offering today, I just put up a link for this as well. So if you want to purchase the Dutch test is regularly, it retails for $4.99. And so if you go to Precision Analytics, which is the lab that creates the Dutch test complete, which is the test that we're offering, it's $499 if you buy it from the company. We're going to do it for $375. We usually charge about $600 to go over those results with you, interpret the lab, look at the lab, and then give the recommendations and the care plan from there. We're including that for free. All you have to do is purchase the test, which is $375, and you will get the test, save 25% on that, plus that 45 minutes or 30 to 45 minutes for me to go over and come up with a customized plan for you. The only thing that we would request is that once we get the Dutch test, is I would have you fill out a wellness intake form, just so I have that information for our meeting, so I'm well prepared and I can really give you as much value on that call as possible. So the step from here is either to get the Gymnema, order the Dutch test. As soon as we see that, I'll reach out to you. Me and my team will send that over to you. You'll get that Dutch test from a company called Rupa. All you need to do is put in your shipping information. They'll send it to you. You'll get a video about how to do that test, instructions for that test, and then it usually takes about 2 weeks for us to get those results. So we would be on the phone in the next, 2 to 3 weeks if you were to start this process today. So that's all I have. Anything you want to close up with, Nurse Nicole?
Nope. I just wanted to let everybody know that thanks for coming. I've done the Dutch test with Dr. Dennis several times. It's not difficult, and it's very eye-opening and gives a lot of information if you did want to work on things for your practitioner or Dr. Dennis to work off of.
All right, everybody. Have an awesome day. Take care.
Thanks, everybody. Bye-bye.
Thanks, everybody.